I'm Dr. Anthony Cave, a Stanford and Harvard trained anesthesiologist and integrative medicine specialist here in the San Francisco Bay Area. And like many of you, I was absolutely shocked to hear about the case of an anesthesiologist at UCSF, a prestigious academic medical center, have one of their pediatric anesthesiologists arrested in the middle of a surgery after being found unconscious in the surgery with an IV sticking out of their arm, with multiple track marks along their arm, with an IV bag connected to them. What was in that IV bag, and more importantly, what you need to know to hopefully help prevent your children and your loved ones from ever being potentially harmed in a case like this, is what we're going to talk about today. This anesthesiologist was arrested on several different potential charges. They have not been charged yet. I am not involved with this case, and we don't know the identity of this individual. It's not been publicly disclosed for her protection. But I do want you to take two things away specifically that you need to ask your doctors and discuss before you or a loved one ever has surgery, because as rare as this incident is, it can happen, and you're going to learn why certain doctors are more susceptible to this happening than others. Literally being found in the middle of surgery connected to propofol and lidocaine. Propofol, as you know, is one of the medications that we use to help patients fall asleep. It's very safe. It's actually not a controlled substance because it's only available in IV form. Unlike opioids, unlike other controlled medications that we think of, benzodiazepines, etc., propofol is not controlled because it's not really circulated in the public. It can have an addictive potential, though it's not typically classified as an addictive substance. Though, as you know, this is the Michael Jackson milk of amnesia. And just like how it helped Michael Jackson fall asleep, excuse me, it's how you know this is live. When it's used incorrectly, can be very, very dangerous because it very potently puts people to sleep and suppresses their respiratory drive and causes unconsciousness. It is very, very safe and has made modern anesthesia incredibly safe when it's used in the proper setting with physician supervision. Using it unsupervised in the operating room when you're supposed to be caring for someone else is not a safe way of doing this. And if you are having surgery, especially if there is a child involved, you do not want the person who is driving the ship to literally be asleep at the wheel, or worse, unconscious at the wheel. This individual, months prior, and this is the scary part of this story, is how many months there had been irregularities that had not been acted on. There had been thefts of multiple vials, I believe 18 vials based on reporting in the San Francisco Chronicle, of propofol and lidocaine. Propofol and lidocaine are used together because propofol burns. How many of you guys have had surgery and have had that burn go in? Please let me know in the comments. I'm watching closely. And I do see Gabby here had mentioned that, yeah, someone's allergies are acting up because of our two cats and dog here. If you want, maybe we can show them at the end. But for folks who have had surgery and have felt that burning, peace of mind says, yeah, that burning is buffered by lidocaine. So when I give this to patients, I will mix the two. I see Jana here is also commenting on her having experienced the propofol burn. But if you're abusing this, you're going to want to take both of them together. So this is an advanced act at work here of taking both at the same time. The problem is that if you're administering this on your own, clearly there's no one watching. And once you lose consciousness, what's to stop you from stopping breathing? These thefts of propofol, like I said, 18 vials, led to an ultimate suspension for 10 days, which is 4 days less than what is required to be reported to the medical board in California. And ordinarily, this would prompt the facility or institution to require some sort of rehabilitation program for the physician, or to terminate them, or any other number of actions. What happened here is really unusual, and the danger of this story is that this individual was transferred from Oakland to San Francisco. We believe the Mission Bay campus in San Francisco, for those of you who are familiar. where this individual continued to practice anesthesia despite the thefts. And it is in this new hospital setting that she was ultimately found unconscious and arrested. She was later released. There are no formal charges that have been carried out. There's a lot of work to do and figure out what happened wrong, though honestly, the reality is that substance use disorder is shockingly high in physicians, and it's highest in physicians who have access to these medications, meaning anesthesiologists, emergency room physicians, and often psychiatrists. Unfortunately, and I have many videos on this which I encourage you to watch, suicidality is higher in physicians, and women are most afflicted. There are many reasons that go into this. Is it an accident or a coincidence that this anesthesiologist was also a woman? Well, there are many factors that go into it. It's probably not a coincidence. It's probably a really very sad story that maybe we'll learn more details about while still respecting her privacy. But this epidemic of physician suicidality cannot go undiscussed. And if you're a patient, you need to be aware of this so that you don't end up on the receiving end of care by someone who is not appropriate to be giving care. And that's why I'm doing this video. Now, as I said earlier, the mental health condition here is not going to be uncommon. The handling is. And an independent lawyer was actually brought in to comment on the story who called this the height of irresponsibility. To have a patient with a known disorder which can compromise patient care, especially for the most vulnerable, which is going to be our children and our elderly, to continue to practice medicine despite this known disability. What does this mean for you? Two questions I want you to always feel comfortable asking. If you don't take anything else away, these are the two important questions. Number one, ask your surgeon if they're familiar with the anesthesiologist. I highly doubt your surgeon's ever going to say, no, I've never worked with them before. But I do believe that your surgeon is going to at least be prompted to be, oh wow, this person is actually really on top of their care. And when a patient asks me questions like this, it demonstrates to me that not only are they involved and they're advocating for themselves, but really there's this little, and this is very difficult as a doctor to share because we believe that all doctors treat everyone the same. The reality is that human beings have all sorts of biases. And I've had many videos where I discuss the squeaky wheel is going to get more attention. It's not good to be a squeaky wheel, but nice patients come out last. And if you don't advocate for yourself and ask questions that might be difficult to ask, sometimes doctors begin to become very routine in what they're doing. I'm not saying that it's good to be obnoxious to people, but I am saying it's very good to ask your questions when you feel an instinctual urge to ask them. And I don't want you to feel afraid of asking a question like this to your surgeon. If nothing else, your surgeon is going to be that much more attentive to your care, I believe. Not because they're bad people, but the reality of being a human being is that human beings are going to become more alert when they are prompted to do so. Number two, I want you to ask to meet with your anesthesiologist, or if it's a team of anesthesiologists, meet with someone on the team so that you can get a better idea of who your anesthesiologist will be. Sometimes I call patients before their surgery to answer their questions so that they've heard my voice. So there's some level of accountability, both from my end, and I want the patient to know that I want them to follow the rules as well. It goes two ways to give someone the safest experience in anesthesia. This is not a joke. This is your life. When you're having surgery, even if everything goes perfectly well, you need to be aware of the risks that can happen anytime, just like when you're flying an airplane. You don't often think of talking to your pilot, but by golly, if something goes wrong, you want to know everything about that pilot. So why not know a little bit more about your doctor pilot before you take the plane off? Because once the plane takes off, you can't advocate for yourself. You're unconscious. And if you're a parent or the child of someone who's very vulnerable, meaning the very young or the very old, I want you to feel comfortable getting to know a little bit about your anesthesiologist because they're going to be more accountable that way. When patients ask me these questions, I don't take offense to it. I think it's actually great because it means that they care about what they are, that they care about the care they're receiving, no pun intended there. And when a patient is that much more involved, you better believe that the human bias is going to lead us to also be that much more, or even more, attentive. It's the reality of the human condition. I'm not saying these implicit biases are right or wrong, but we do live with them. You might as well be aware of them and not try to be naive to them. I care about your anesthesia, your surgery experience, and I hope that you do as well, to ask these questions. Don't be afraid to, especially in big centers where there's multiple doctors coming in and out of rooms. It's so easy to lose accountability when there's 10 people in an operating room and the family or the patient don't even know who's in there. I'm not saying it's wrong to have multiple people in the operating room. Sometimes that's very necessary for safety, but it's not appropriate to have no accountability at all and not know who the patient is, or the patient to know who their doctors or care team are in elective situations. Of course, there are some emergency situations that are different. If the patient shows up unconscious, that's different than if the patient shows up walkie-talkie, and getting ready for an elective case. So in pediatric anesthesiology, there's often two anesthesiologists, maybe an attending and a resident in an academic center, or a CRNA and an attending physician. The more people you have, you don't want accountability to slip through. If this is resonating with you, please share what you've learned with loved ones. Like Peta Princess says here, be honest about your fears. Ignorance is not a bliss when it comes to your life on the line and the medical care that you deserve. I want you to know that you have more power over your health than you've ever been told. If you're learning something, please hit the like button to share what you learned with others. I'm going to answer some of your questions live now because I very much appreciate the very thoughtful questions in here. And I want you to also be aware that we're going to have a live session in just a couple minutes after this for the members. If you want to join the membership, that's wonderful. Your support gives you access to more one-on-one time with me. And I want you to ask your questions, and I'll go through as many as I can here. I like how Art by Hazelka spoke to her surgeon, or him. I can't think it's a woman here in the picture. The whole team before you went under. Art, I hope that helped you feel more prepared for your surgery. You let me know, please. Heather, very good to see you. Good morning to you as well. Happy Sunday. Mara had to change surgeons because the anesthesiologist was rude and dismissed me. I'm sorry that you had that experience, but I'm sure you felt better going to sleep with hopefully an anesthesiologist that you were better able to trust. Chinook Valley is never going to have another surgery where the doctor and all the involved staff don't have time to sit down and talk. And I agree that hurry in elective cases is not appropriate. Now, Chinook Valley, I'm sure that we're all going to be in agreement that sometimes there are emergency situations where we need to hurry to save someone's life. And that's going to be an appropriate time to rush. What's not appropriate is to do this when there is ample time. Like Wywolf says, it is very important. Yes, you have a DNR bracelet, and I certainly hope it's respected as well. I would hope it would be if it's a bracelet and it's clearly demonstrated the do not resuscitate order there. KK Claudette is on a non-invasive ventilator with an oxygen requirement for vulvar cancer. A pulmonologist suggested an epidural block. Well, there are always alternatives. There's always risks and benefits to everything in medicine. But I don't know enough about your case to comment. I certainly am wishing you the best, though. If you have difficulty with breathing, that epidural might well help. So I would encourage you to also speak with the anesthesiologist who might be placing that. Can you be sedated with propofol while taking Suboxone? Yes, you can. And I do know, Lisa, people who have been tattooed with their DNR request on their chest, or severe allergies like malignant hyperthermia or type 1 diabetic, so that it is very clear in emergency situations. Art, I love how you were cracking jokes before you went under. The way that folks fall asleep, please, everyone listening, has some bearing on how they wake up. There's many variables that determine how we wake up, but the more we're able to enter the altered state of consciousness from a place of comfort and confidence, the greater likelihood it'll be that we wake up that way. You're very welcome, KK Claudette. Layla had infectious tenosynovitis. The anesthesia experience resolved my fear of anesthesia. I'd had a bad experience when I was much younger. Well, I'm sorry to hear about that infection, but I'm grateful to hear that it overcame so much of what you had been struggling with before. Wow. I'm so happy to hear about that experience. And Layla, I'm sure it was, I would imagine, through you hopefully speaking up after the bad experience you had with a dental implant prior, hopefully helped you get better care to help you overcome some of that. I don't want to use the T word lightly here, but likely some degree of medical trauma that your body experienced. Wow. Well, you are very welcome, Lisa, and you absolutely should tell your anesthesiologist if you're taking Suboxone. It's very, very important. And we'll end with this comment. For so long, I was too intimidated to speak up. I'm learning how to be a better advocate for myself thanks to your videos. Sam, I'm so happy to hear that. And that is perhaps one of the greatest powers you have in the broken medical system that we all live in. That nice patients come out last. You have to advocate for yourself. Please be respectful in doing so. But do not ignore your gut instincts. Because this is the most common things that happen. One of the most common things that can happen to folks who have been traumatized in the past. To disassociate from their instincts that might be life-saving. And I'm so happy you got to see the surgical team, exactly the type of advocacy we're talking about. Thank you so much, everyone. Happy Mother's Day to everyone as well. And remember, you have more power over your health than you've ever been told. For your members, we're going to hop onto our live stream in just a couple minutes here, where you can ask me some more private questions here in our smaller setting. Till next time.